Good afternoon. It is Thursday at 4 p.m. We've all been together now 4 times this week. Every day we have shown another school or school system that is stepping up to do their part, protect their kids, work to get back to in-person classes. Today it is Livingston County. We appreciate all of their efforts to educate all of our children, to improve this Commonwealth as some of our most important job creators, and to keep people safe during this difficult time. Our educators, everybody who works in those buildings have been incredible heroes during this, taking care of the needs of kids, even when they're not coming into that building every day. Today's update, it's really going to be in 2 parts. In the first part, we got some really good news about things going on in Kentucky. A whole lot going on, including a pretty special jobs announcement. In the second half, where we talk about COVID, it's going to be a lot different. Today, I think we have the 3rd highest number of cases that we've had since the beginning, though our positivity rate stays below 5 and continues to drop. But it's important. It's important during these times that we also see the hope, the positivity, the new businesses investing in Kentucky every single day, and there are some real special both projects and this jobs announcement today that I am pretty excited about. So we're going to go through our first 4 pieces of news pretty quickly. They are all pretty exciting. First, infrastructure recap. This morning we were able to announce grants to 4 eastern Kentucky counties that are going to help ensure that people have clean drinking water or the infrastructure that they need to attract jobs. I believe that clean water is a basic human right. I've talked about working to make sure everyone in Kentucky has access to it, and nowhere more than eastern Kentucky do some people and even some businesses lack that access. So in Floyd County, we announced a $248,955 grant for the Estill Bottom Emergency Water Line Project. This is going to repair an outdated water line. It'll extend 1,700 linear feet of water line to provide better drinking water for 15 area businesses and 300 households. This is the point that everybody counts. These 300 households will now be able to get clean, safe, reliable drinking water. That's progress, and we're excited about it. Harlan County Fiscal Court getting $153,846 for their Business Park Natural Gas Infrastructure Project. They have an exciting business park down there, ready to attract more jobs to the area. The number one thing those businesses have asked for is to see that natural gas hookup ready and available before they agree to come. This is going to move Harlan much closer to attracting that next series of businesses. Paintsville and Johnson County, they're going to use $1.5 million grant for the Paintsville-Johnson County Economic Development Sewer Expansion Project. It's going to extend a sewer line from the Paintsville Wastewater Treatment Plant to the Honey Branch Wastewater Treatment Plant. It's going to provide utility service for 10 area businesses and 75 households. Again, everybody counts. Let's make sure that we have clean water and the necessary sewer lines to everybody throughout this Commonwealth. And finally, Salyersville, Magoffin County, they're going to use a $453,580 grant for the Route 30 pressure sewer project. It's going to be one that provides reliable service to 3 area businesses, 27 households, and let me tell you, with the Mountain Parkway and our effort and the dollars we are putting in to open up eastern Kentucky, Salyersville and Magoffin County, and all these other counties, but with the expansion coming to Salyersville, to Magoffin County first, there's some really exciting things in the future right there. So those are 4 projects, even in the middle of COVID, where we are providing the infrastructure to where we don't just rebuild, we build better here in Kentucky. We make sure every area has the ability to compete for the jobs. We're going to talk about those today to make sure they have bright futures for all of our children, and no one is ever told they need to move to pursue great opportunity. All right, second one, which is roads. Today, we're announcing in Monroe County an exciting announcement for Monroe County of 3.8 miles of new road, creating an alternative north-south route. The goal of the bypass is to relieve traffic congestion, reduce large commercial truck traffic in downtown Tompkinsville, and improve access to the industrial park. As you notice, everything we are doing when we're investing during this is about the future, is about jobs, is about a better life. In addition to relieving congestion and large commercial vehicles in the downtown area, the new road provides more direct access to the East Side medical and emergency health services. Construction will begin. Construction has begun. It began in November 2017. It's finished now. $28.5 million project, and including numerous safety improvements. Congratulations to Monroe County, an area where sometimes they feel like they might not get these dollars coming from Frankfort. This is exciting. And again, it ensures every part of Kentucky has real opportunity. I'm going to flip the next two that we were going to talk about. This came through this afternoon, really exciting. 9 Kentucky airports are going to receive more than $94 million in grants. This is a huge amount of money coming into some of our largest, but also some of our growing airports. They include airports in E-Town, Gilbertsville, the Kentucky Dam State Park, the Cincinnati Northern Kentucky International Airport. Of course, huge things going on there with Amazon building one of its largest transportation air facilities in the world right there. Lewisport in Hancock County. Of course, Lexington's airport, Louisville's airport, Middlesboro, Paducah, the Barkley Regional Airport is getting a significant amount of dollars. You may remember before COVID, we announced an investment that was going to allow them to rebuild their terminal. It's really exciting with the investment that's going on there, and this is going to help bring it to fruition, open up Western Kentucky. When you look at I-69, which we're committed to doing, you look at some other improvements they've made, and then you give them a world-class airport, Western Kentucky is poised to take off again. So think about it. We talk about opportunity, wanting it everywhere. And today we've talked about Western, Eastern, and Southern Kentucky. So pretty exciting. Last part of our very first quick 4 things, you gotta vote. I think that right now we've had several 100,000 Kentuckians request their absentee ballots. If you are concerned about COVID, about going into a polling location, worried that you could get it and be harmed or spread it to someone who will be harmed, make sure to go voteky.com and get your absentee ballot. I think we have an opportunity to break every record for turnout here in Kentucky because we have more options than ever before on how to vote. Vote by absentee ballot, vote in the early voting, which is 3 weeks out from the election, vote on election day. Now, this is the bedrock principle of democracy. We've got, I think, 190,000 people that have had their voting rights restored for this election and every election after. This is an exciting time. Please get out and vote. All right, our next piece of great news today is about Wild Brands, a new great Kentucky company. Today we're joined by Jason Wright, founder and CEO of Wild Brands, and his team to announce the company's new 50-job manufacturing facility in Winchester. Their nearly $10 million investment in job creation are helping us to build back better. In addition to their role in making Kentucky's economy stronger in the future, Jason and his team are true innovators. Wild Brands makes snack chips using all-natural chicken breast. That's right, they've replaced the potato in potato chips. Their Wild chips are high protein and keto diet friendly. As an innovator, because he is, we talked about some of the machinery that they had to build, and he's talking about trying these in his own kitchen. Jason conceptualized and oversaw the development of an industrial frying system specifically for animal protein chips. It's the only one in the world, and he holds the patent, so everybody out there will eventually be jealous, and they can come talk to you about that. The system's going to be installed in the company's new factory in Clark County, meaning we're going to have it here in Kentucky, some of the newest technology. Renovations are underway, and the Wild Brands operation is on target to open late this year. One of the reasons Wild Brands selected Kentucky for this project is Team Kentucky was able to move fast. It's one of the things we're talking to every business on. When you're making a decision and you're ready to start a new part of your company, you want to do it fast. I'm proud that Team Kentucky is able to bring together multiple cabinets and agencies and to truly be responsive. Time's money, and speed was and remains paramount for this project. That's why today I'd like to also thank developers Ron and Patrick Tierney, who quickly met the company's needs. Patrick's here with us today, got to talk a little bit about how this all came to fruition. But remember, our developers aren't just in business on their own. They are selling Kentucky. They are selling their communities. They are selling opportunity every day, and we owe them a big round of thanks for the development that we see here today. With that, I'd like to turn it over to Jason Wright and his team to say a few words about their company, their new facility, and why they chose Kentucky, though the reason is pretty clear. I mean, it's the greatest state in the United States. Jason.
Andy, that's well said. I really appreciate it. Thanks for having us. You know, we are super excited to be here in Kentucky. The Tierneys you mentioned earlier, they were a big supporter in bringing us to Winchester, and I'd like to thank them. And you nailed it. Speed was really a big part of this, as well as being centrally located, because you know, talking about our equipment, you know, we're a small company. We only have one, you know, or two big custom-built fryers, and it was important for us to be in a facility that we could get to the East Coast and the West Coast, you know, within a day's drive. So Kentucky was real appealing to us. But you know, WILDE, you said it best. It's a never done before product. It's a product made of chicken breast. It eats like potato chips. We deliver 10 grams of protein. We have crazy flavor profiles: Nashville hot, buffalo, chicken, and waffle. And at the end of this year, 100% of our products will be made here in the state of Kentucky. We'll also distribute and sell to Amazon, and our direct-to-consumer business will go out of our Winchester facility. So, excuse me, we're super excited. And the one note I'd like to say is, for the first time ever, pork chips will be introduced, and we will introduce them, and they'll be made here for the first time in the state of Kentucky. And this product can be found from Whole Foods to Kroger, and in other, you know, stores as we expand our distribution with this new 50,000 square foot facility. One thing I'd like to note, that we're going to create about 30 jobs this year, and we're looking to add about 50 to 75 plus in 2021. This will be my second home. You know, I'm originally from South Carolina. I started the company in Boulder, Colorado, but we're moving 50% of the company now here to Kentucky.
Great. Thank you, Jason.
Thank you, Andy.
And we're going to work tirelessly to make sure we can get that other 50% here. And we'll keep making sure that we're providing the very best offers. And I can't wait until Jason and the other families involved get to see what it's like to live and to work here. All right, so listen, lots of good things going on in Kentucky. And no one's pausing everything we need to do just because of COVID. But COVID is a 1 in every 100-year epidemic, and we got to take it seriously. And we're seeing a rough week this week. While our positivity rate is going down, we got a lot of testing going on, which is a real positive. We are just seeing some high numbers. So today we're reporting 906 new cases of COVID-19. That's our third highest total since the very beginning. Today's 906 positives include 124 kids, 18 and under. It brings our total cases not just above 50,000, almost to 51,000, at 50,885. Our positivity rate, though, has actually gone down since yesterday because we had a significant amount of tests come in. And that's good. We want that rate under 5. We really want it under 4, and if we can, push it down even further. But we definitely want less overall cases too. There are two metrics that we're looking at the same time. We are thankful for the number of tests because it lets us react better, make sure that we can do the quarantines that are necessary and prevent it from spreading even more. But I do think it shows that we're probably being a little more lax in our daily lives than we should be right now. You know, 906 cases used to be unfathomable here in Kentucky, and now we're seeing it more often than we ever wanted to. Let's make sure that we do something about it. So, wear your masks. Livingston County is doing it. Stay 6 feet apart. And as Dr. Stack will talk about, make sure you're really careful this weekend. It's a time when we could have major spread in the virus. Let's make sure that it's not. New cases by county. We have 95 counties with at least one COVID case today. That shows how widespread it is. I'm just going to read the double-digit ones, and that's even going to take some time. Jefferson County, 192. Warren County, almost 10% of today's results, 89. Fayette, 68. Madison, 66. Davis, 25. Greene, 21. Henderson, 20. Kenton, 20. Pulaski, 19. Union, 18. Franklin, 17. Hardin, 16. Jackson, 15. Logan, 15. McCracken, 12. Oldham, 12. Bell, Callaway, Campbell, and Scott, all with 11 cases apiece. Barron with 10. And then, the list today is 3 pages long. It'll be on the website. Don't be fooled. It's in your community. Make sure you do what it takes to protect yourself, protect your family, and ultimately protect people that you don't even know so that you're not spreading this. And I know we're asking a lot. I look back, and as governor, one of the things that you do is you travel. You have all the different means to travel. Before this, we were traveling at least twice a week, being all across Kentucky, celebrating some real exciting news that was out there. And I'm really not doing that at the moment because I'm trying to live by the suggestions that I'm making to everybody else. But I'm also a dad. I'm a husband. And I want to do what it takes to make sure I'm protecting my family too. We need everybody else out there to be thinking about it that way as well. So please do what it takes. 10 new deaths. This week is going to be probably the single largest week we've had for losing Kentuckians. Today's list includes a 72-year-old woman from Jefferson, and then also a 79, a 72, and an 85-year-old woman from Jefferson, all women from Jefferson. An 88-year-old woman from Lewis, and a 76-year-old man from Lewis. A 70 and a 73-year-old man from Jefferson County. A 52-year-old man from Barron County, and a 60-year-old woman from Jefferson. Again, we see all different types of counties. We have people in their 50s, 60s, 70s, and 80s on today's report. So, in your 50s, your parents. In your 60s and 70s and 80s, you may be grandparents. So, again, let's have those green lights. Let's honor those we've lost. There are a lot of people this week, a lot of families that are going to need us. Let's make sure we're there for them. Ring those bells at 10 a.m. These families don't have the option of being tired. They don't. So we can't be tired either. We got to be there for them. A couple of the areas where we break down information, and folks, please go to the website, kycovid19.ky.gov. I got a letter from some folks. I knew some of the folks on it, really intelligent people, but didn't know of half the cases in their field that are all published online. You can go if you want to look at long-term care, if that's where you are, click on it and get detailed information, facilities. If you're schools, you can go and you can click and you can see information about specifically where cases have been. And that's really important to know if they're in your county or in your backyard. So please, kycovid19.ky.gov. We're asking more of people as we go forward, more decisions to be made by our leaders, our local and our school leaders. And we just need to make sure that you are actually looking at the information and the data that's up there, because we all know if we have more and better data, we make better decisions. And we are always trying to work to provide it in a better form. One of the reasons we're still trying to work on a faster dashboard for schools is our data, because of what it has to go through trails. Several days, if not sometimes more. And if you're operating a facility in a certain city, you probably want to know pretty quickly what else is going on out there. So we're working really hard on making that happen so that we can meet our goal, which I anticipate we will, of having kids back in class on September the 28th. All right, long-term care facilities, 28 new residents, 26 new staff, 5 new deaths. K through 12 Kentucky schools, 67 new students. That means, again, it doesn't mean that their school is necessarily in person or not. You can go to the website, you can click on it, you can see it by school district, you can see it by actual school, you can see active cases versus previous cases. You have all of that information at your fingertips. 22 new faculty or staff. And again, 44 new schools have at least one positive case that has been associated with them. Again, it might not be active. When you look at the active cases versus the total cases, you'll see that that not all of them are active. Now, we are working on trying to address this issue of numbers of recovered individuals. We just don't know enough about this virus. We have people that are still, they don't appear to be infectious, but they're still suffering months later. So what does it mean to be recovered? I think one thing we're working on is perhaps whether it is active or inactive, meaning the virus can be spread. But I don't want to present a false sense of security saying that people are just recovered when it appears that you can have complications even when you're no longer infectious and maybe when you haven't had complications for several months. That's us trying to make sure we are presenting the data in a scientific and honest way. And it's this piece on what word is used there is difficult. It's a challenge as we're learning more. Finally, colleges and universities, 69 new students, 2 new faculty or staff, 1 new institution. With that, I will turn it over to Dr. Stack. He has a short list, and then we will get to questions.
Thank you, Governor. Good afternoon, everyone. I actually have a longer list of things to go over today for the reporters here and the ones at home. Hopefully there's some stuff you can convey from here because these questions keep coming up. I'm going to do something I don't normally do. We have some reporter questions here that I'm going to tackle and use the press conference to do it. The first one has to do with COVID-19 vaccination. The question that came in this instance was from Selena from NPR, and the questions had to do with the coordination with the federal rollout of the vaccine, creating distribution centers, the timelines, which are short as they're presented, and I wanted to put this in context. So Kentucky Department for Public Health, in partnership with the Kentucky Emergency Management Agency and others, and local health departments, is working to create our plans in partnership with the federal government, the state government, and the local government, so that when a safe and reliable vaccine is available, we can deploy that in a timely manner to everybody who's eligible for it. There are some things I want to mention about this, though. I've said this repeatedly, I'll say it again. There will not be a vaccine for virtually everybody this calendar year. I know that there's a press to make these timelines suggest we're going to have vaccine going out the door to people in October and in November. Let me be very clear about this. Because of the nature of this disease and that vaccine, we will do our very best to review the evidence available so that we can recommend affirmatively to the people in Kentucky when it's safe to get a vaccine. There are some really good and incredible things that have been done to accelerate the progression for how quickly we can get a vaccine, but there are some corners that cannot be cut. When you give a vaccine to a healthy person, you have to ensure that you are not going to take a healthy person and hurt them. Vaccines are incredibly safe. They're one of the modern miracles of medical science, and it's imperative that they continue to be safe. And so we have to finish those trials. There are no shortcuts. And so we have to see where we are each step along the way before we're going to recommend and then deploy those on Kentuckians. We're not here to experiment on you here. We're here to keep you safe and prevent illness and disease. But yes, we are working very actively. We are well aware of the timelines, and we are in active collaboration along all three levels of government. The next question, L. Cross had a question about testing. There's been a lot of discussion about the various types of tests, pivoting and strategies, trying to get more rapid tests, maybe a little less reliable, but rapid and more easily available to people across different settings, not just in a lab or at a hospital, but perhaps at home or in schools and other locations. There's some exciting science and exciting possibilities in this. There really are, and we're actively working on those things. I do want to put that in context, though. So we have typically relied on the healthcare system to provide medical testing and for people to get tests. That is almost always how we get our medical evaluations. There are some instances where you can go to the drugstore and buy a pregnancy test, or perhaps buy a HIV test. There are some conditions for which the Food and Drug Administration has approved that the test is safe enough, reliable enough, and someone can properly interpret the result, that it's safe to release it to the public. We're in the middle of a global pandemic, and we are having tests approved in ways and at a rate that has not been done before. The standard for approval has been lowered. The types of approval are not necessarily always even approval. They're tolerance or acceptance of the existence of a test, which is not the same thing as scientifically rigorous approval. Now, I don't say that to undermine confidence in these things. I've said consistently all along this that there are some tests that are ready for prime time, and you should have great confidence in that. The laboratory-provided PCR tests, polymerase chain reaction tests, are incredibly reliable, and we've got some wonderful laboratory service providers here in the state and hospitals doing great work. The challenge with those is they take a little more time, and sometimes they take too long in other states. In Kentucky, for the most part, we do pretty well there. There are other tests like the Abbott ID Now, which is a point-of-care test for molecular diagnostic test for like a PCR version. And then there's antigen tests, and now there's multiple platforms. 4 of them are approved so far. Those are all useful in the right setting, but you have to know when. Those are better used on people with active symptoms and disease. They're more reliable then, but you may miss people without symptoms in an asymptomatic population. Doesn't mean they're not useful, it just means you have to use them properly. And so we're going to continue to advise the right place, the right time, and how you can use those safely. And then there's those little chips that you may have seen. There's a new Abbott chip, and the federal government says they're going to distribute millions of those to states in the very near future. And we're very grateful for that resource. I think that's a good example of the federal government providing resources. But how we use them matters. So all you hear a lot of times, and this is not a criticism of media, it's just the leveling of the reporting that is appropriate, is it's a $5 test and anyone can do it. But the approval document for the test says it has to be done in a CLIA-waived laboratory or by a CLIA-waived laboratory. Well, there's no K through 12 school in the state that's a CLIA-waived laboratory. So there's a lot of other complexities that go with this. And then even if we get an initial shipment of these, the company can only produce so many. So you can do a one-off test, but you can't sustain it if you can't buy the materials and continue it past the initial trial. So none of this is intended to discourage us from finding innovative ways to try to manage the disease and get us back to work faster and keep people safe. But I do think it's very important, and I hope you've come to have confidence and rely in what I and we say here, that we will continue to try to advise you based on the good science and the availability of these resources so we can keep people safe. The saliva test, I'm just going to mention that. People have talked about the saliva test as some sort of a miracle test because you don't have to have a swab and somehow it's rapid. Let me disavow you of that belief. You have to drool a lot of spit into that tube. So anyone who hasn't dipped, and I have never dipped, so I don't recommend you try, you got to drool a lot of spit into that tube. It's pretty gross, and it's not so easy. A lot of people actually struggle to do that as they drool all over the inside and outside of the tube. But then you have to ship it to a lab or get it to a lab. They still have to run it in a high complexity lab. So it's not a $5 or $15 test. Someone in a laboratory with expensive machines still has to run the test. So, and then because saliva is so sticky, so you all don't need me to describe that, just your spit's pretty sticky, it gums up the machine, so you can't use it on an automated machine. It has to be a manual process. So I tell you all these things, one, because I hope you have confidence. I mean, there's a lot of complexity here, and I try to tell you that as straight as I can. But that is not a panacea, but it could be a useful tool. Three other really quick things. The governor's being indulgent here for my time. For quarantine, I just want to make this point, because this has come up repeatedly. Please don't look for the excuse to do the wrong thing. Look for ways to do the right thing. Quarantine is not punishment. Quarantine is how we keep people safe, minimize the spread of infection, and keep the economy open and people back to activities. If you have a high-risk exposure, and that means that you're likely or very high possibility of spreading infection or becoming infected yourself, you have to stay away from other people. If everybody's looking for excuses to get out of quarantine, then our case rates are going to shoot up real high, and we're going to have the bad consequences we've worked so hard to prevent. So we will continue to evolve our guidance for who has to be quarantined or not as the evidence continues to evolve. But right now, in the whole concept, I just want to mention this, of critical infrastructure workers, unfortunately has been misunderstood and distorted quite a bit. When everything was being shut down in the spring to keep people healthy at home, when we had so many things we didn't know, it was essential that certain workers could go to work so that we had energy, so we had food, so we had basic infrastructure to be able to survive. We're at a very different place now. Every business is open, even if at lower capacity, or has the ability to be open. They're not prohibited. And so the whole concept of a critical infrastructure worker is very different now than it was in the spring of this year. So it's not an excuse for everybody to avoid quarantine. It's a serious concept for when we have a different type of crisis. So we're well aware of that. We're working to keep people safe, and quarantine and isolation is part of that. I want to touch on schools. I want to make a distinction here. The governor references our current report for schools. That school reporting is done by public health, communicating with individual persons who are infected and also with schools, and we get that result. We hope that the information we present is very accurate, but we continually revise it as we learn more information. That report takes time to bake. It will not happen as fast as somebody gets a test result. It takes days, sometimes numerous days, for all the people to communicate and for the information to be updated on that spreadsheet that he shows. Use that as a resource. It is a very good resource, but people are calling the poor secretaries at my office all day long saying, well, we know about 8 cases here and 2 cases here, and it's not on your report. That's not because the report's not reliable. It's because the report has a time delay in order to get the level of accuracy we strive for in that report. I am having discussions with the Kentucky Department for Education and between my department, and I'm very grateful for them as we try to navigate creating some type of self-reporting system so schools can report some basic, very simple information and closer to real time. But then I'm going to really, work hard to get the schools to report that, but then I'm going to stick up for the schools if they're reporting the information when people criticize them, well, it's only these numbers. They can only do so much, both schools and public health, and I'm very grateful for the partnership because we've had some very productive discussions, but these are difficult issues. I'm almost done, Governor. The colleges and universities, there's a number of colleges and universities who have created very nice dashboards, and there are more that are creating them as we speak here. We hope next week to be able to have a dashboard that we can show on, well, not a dashboard, a web page where you can go to kycovid19.ky.gov and click on the college and university dashboard link and have links, direct links to all the colleges and universities who have dashboards in the state of Kentucky. I've worked with the Council on Post-Secondary Education and the Association of Independent Kentucky Colleges and Universities and spoken with the presidents of all these various institutions. I'm very grateful for your partnership. I say this not just to consume time and space, but to say we're in discussions with a whole lot of leaders across all of the society in the state on a regular basis. We couldn't get through this without these collaborative relationships, and I'm very grateful for them. For athletics, I'm aware that we have youth athletic guidance for Healthy at Work. and then the KHSAA guidance. Just for the trainers and others, we're working on harmonizing those, and I hope next week we'll be able to have progress on that. Thank you for your understanding as we're working across the education community, the athletic community, and public health, and trying to find approaches that we can all work on. And now my last wrap-ups here. I had the chance to get out of the office yesterday. One type of work for my job took me up to northern Kentucky, and while I was there, I purposed it for other things. I had the chance to visit Gravity Diagnostics Laboratory, and you've heard us mention them repeatedly. That's the lab that in early March was the only entity we found who was able to rapidly scale and provide testing in the way we needed to do it. It's absolutely amazing how much they have expanded and grown to be able to run the tests they do. On peak days, we run probably 5,500 to almost 6,000 tests a day for the state of Kentucky through the program that Kentucky and Gravity have worked together to build. I am very grateful to them. There are over 200 employees there, and I got to see a number of them. Thank you. You're incredible members of Team Kentucky, and your contributions to all of our health and wellness is appreciated. I also had the chance to visit with the Northern Kentucky District Health Department, and I can't give enough credit and enough thanks to the health department workers all over the public health workers all over the state. They're working very hard on your behalf, our behalf, to keep us all safe. It's Labor Day weekend this weekend. It's the Oaks, and it's also the Kentucky Derby. All sorts of wonderful things we celebrate in our state. I hope you have time to spend time with friends and family and enjoy hopefully some nice weather, but please do it safely. This is exactly when people take their eye off the ball. This is when we get together for parties in our backyards and family from out of town comes together. People have a glass of wine or a glass of bourbon or a mint julep, and they forget about the key things that we have to do in the middle of a global pandemic. So please watch your distance, wear your mask, and wash your hands. Please do those things so that we can enjoy each other, but stay safe. Though we may be at a plateau, we're on track to have another record total this week, which is not good. And that's a challenge. We're at a higher level now, and if we take our eye off the ball and it gets out of control, we could find ourselves much more easily and quickly in trouble. So please watch your distance, wash your hands, and wear your mask, and we can enjoy each other and do it safely. So thank you very much, and thank you, Governor. And don't dip, yeah. Don't dip. Don't ever dip.
All right. Lawrence brought to my attention that I had failed to provide the positivity rate. It's 4.53% for today. That is down from yesterday. That's good news. We want to see it go down further. It doesn't blunt the fact that we have too many cases, but it is a positive sign, and we look at all those different indications. One last piece, and it's in response to some questions we've had this week. It's about the National Guard's presence at the Kentucky Derby. Since the 1950s, the Guard has had a presence at the Kentucky Derby, always working to provide public safety. Normally, it's about 220 Guardsmen and Guardswomen that do traffic control and, again, are there to provide for the general public safety. This year, we are going to have a smaller presence, about 130 Guardsmen and women. They're going to operate traffic, again, and access control points that are not in the designated area of the organized protest. This is something that we have done every year. We want to make sure that we continue to provide for the public safety, even though things are going to be a little bit different this year. I know that we're going to have people that are outside the Derby giving voice to frustrations, giving voice to requests for change, to address systematic racism. And I want them to know that I'm going to continue to listen. I'm going to continue to try to hear. After we heard this week that there appears to be some interest by the Kentucky Republican Senate leadership of having some legislation, perhaps even in a special session. We've set up a meeting for early next week with the Kentucky Black Legislative Caucus, because that's a critical group to ensure that we are communicating and developing potential policies with. We're also going to be holding listening sessions, most of which will be virtual throughout next week, and making sure that we're also reaching out to those hardworking law enforcement officers and getting their input to make sure that we sometimes we're just speaking in slightly different languages, and if there is a way to figure out where there is good common ground where we can all do better, feel safer, and be safer in our job, that's something that we want to make sure that we're a part of fostering. So with that, we'll open it up for questions. I know she had to go yesterday or 2 days ago, so we'll start with Debbie.
I gather Dr. Stack maybe was referencing CDC news that came out today that they're looking to get states to help them be ready to distribute this vaccine as early as November. Can you say anything further about that and whether you all have been asked, and if so, what you're doing?
So we saw the news just like everybody else did, that the CDC had put out something saying be ready to potentially distribute a vaccine as early as November. We're going to make sure that we do the work to distribute the vaccine as soon as it is safe. We still don't see any path for there to be a vaccine that's gone through steps that it needs to before the beginning of the year. But again, I don't mention that as a criticism. That will still be the fastest by far that there has ever been a vaccine created. And the fact that it's being, even if it's at the beginning of next year or a couple months in, that'll be a credit to the administration that is helping to push it. But we do not see any scenario where in late October or early November there's a vaccine. It has nothing to do with an election. It has to do with how long it takes to get a vaccine. And we don't want to make mistakes in the past. There were issues with polio vaccine. And we also want to make sure it's effective, that you can lose the public's confidence if you ask them to take a vaccine that then doesn't help, and then you ask them to take another one. It's the difference between 1 shot and 2 shots, or 2 shots and 3 shots. Nobody wants more. Ask anybody who's taken allergy shots. Lawrence?
With the numbers already high, talk about your specific concerns during the Labor Day, Derby Day, and what the potential impact is.
The question is, with the numbers high, my concerns about Labor Day, Derby, and Oaks Day. I do have a concern because it means that there are more and more people out there that have the virus. They say up to 40% of people who have it are asymptomatic, so we know that it is widespread and we're only catching part of it. And that means if you're having big gatherings, that there's a likelihood that someone has COVID based on what we see. And so I do have concern that if people don't kind of heed the warnings and have big gatherings as opposed to 10 or less, that we could see a further increase in our overall numbers. Remember, these numbers are almost a snapshot of about a week ago, maybe 2 weeks ago, and what we see in this many cases, even with under 2% mortality rate, means we're going to lose a lot of Kentuckians. So please everybody, do Derby, do Memorial Day, do everything a little different this year. Do it safely. They're asking it once. I don't think that there's ever going to be an ask like this again. Do it for your family, do it for your community, do it for your own personal health. Do it because your faith compels you to protect other people. Do it because it's the right thing to do.
Would you clarify the masking distancing requirement? Do you have to mask if you're 6 feet apart or not?
So if you are inside, generally you ought to be wearing a mask. If you are at a Derby party, unless you can spread out really, really significantly, and unless you have really good ventilation, we would highly recommend wearing a mask. If you're going to sit down to eat inside, again, we'd suggest that you do it outside, but just spread out as far as you possibly can. We say 6 feet, more is better. And if you're unmasked inside, it's much better. If you are outside and you can stay 6 feet apart, you don't have to have the mask on. But if you're with more than 10 people, kind of in a confined space, let's be realistic. People are walking around and moving around, and that means you're going to be putting it on and taking it off. So if you keep the numbers at the right place, you can follow the rules to stay safe a lot better. And I hope everybody's out there getting tested every so often too. That helps too. Tom?
What will it take to allow restaurants to go increase their capacity and perhaps hit 100%?
The question's on restaurants and when we might see 100%. I've tried to be transparent with the people of Kentucky even when it's bad news. I don't see us hitting 100% of restaurant capacity until we have a vaccine. It's right now, the federal government in most of our counties wants it to be at 25%. We've taken steps knowing that these are small businesses to increase that at a rate that we hope they can survive. But the forecast until we have either, you can also have a really successful treatment, getting to 100% of anything, anywhere is going to be a challenge. Joe.
I kind of have a clarification question. So, did you actually, you or Dr. Stack or his office actually receive any notification from the CDC to prepare for a vaccine to come in November?
Dr. Stack, you received a notice about the vaccine? Okay. Right. I saw it on the news. A little surprising, but again, they're working really fast on the vaccine. I think it's going to be a great success story. It's just, it's not going to happen in the next 2 months. But if it happens at the beginning of the year, fastest in human history. Catherine.
That contributed to today's case report?
We are not aware of any backlog that contributed to today's case report. As we become more and more online, we hope that we get better and better data from everybody that's out there. But what we're seeing is continuing to have a lot of tests and in fact having even more tests as we go forward. And we have more people doing them. So all of our hospital systems, all of our doctors doing certain types of procedures have to test their patients for COVID, and so that's one group. Then we have more testing locations around the state than ever before, and so no, we don't believe there's a backlog. There's nothing strange going on in the system. But we are really excited that the level of testing is going in a different direction in Kentucky than most. We're going up. Debbie.
Louisville continues to have pretty high positivity rates. They're still over 9%. Given that, are you concerned about what's going on there, especially with Derby and everything coming up?
Louisville has a very high positivity rate. It's one of the reasons that the Kentucky Derby is being run without fans this year. I think it's something that the school system is looking very closely at and in making its plans. It's a real challenge what we are seeing in Louisville and Jefferson County right now. So we definitely need people in Jefferson County to wear a mask, to spread out, to continue to get tested, because one of the ways we bring the rate down, it seems strange, is to find as many cases as possible, which may have the rate up, but then by doing the quarantine and doing the right things, we can ultimately bring it down. One real positive is that there is a lot of testing going on in Louisville, and there could be an argument that they are just finding more cases than in the rest of the state. We don't have the data to back that up, but there is a lot of testing going on. And ultimately, if people out there have it, we want to find them to help them to ensure they're okay and to not spread the virus. I do believe that the city and the state combined are doing a good job on the testing front in Louisville. And I know their local health department is working hard, and there's a lot of communication out of city government too.
Approved U of L's plan yet for fans in the stands for football?
We have provided our preliminary approval to several universities. I believe they include U of L on their plans to have fans at football games at this point, outdoor activities. I believe it is about a 20% capacity. Everybody spread out, only sitting next to family units. The university worked pretty well with us. I mean, they started out in a different place, but it was at the end of the day, the President Benaputi had called and said we want to do this as safely as we can, and I think they showed that commitment. Same rules are going to apply to all the universities, though. Basic fairness. I think we've also approved WKU and maybe one or two others. I think we have UK's. I'm not sure that we've gotten through it yet, but I can tell you from our end what we're asking for will be the same. Tom?
Governor, you made reference to a little earlier about the folks who are going to be able to vote for the first time.
Yes.
Restore their rights. Has there been any effort by the administration to inform them about how to register and work with them on getting that?
So the question is on those that have had their rights restored, individuals that committed nonviolent, non-sexual felony offenses, but have served their time, have done everything we ask of them in society, haven't reoffended, and they deserve the right to vote again. I remember one of the individuals who got his rights restored being here when we announced it, having his 2 baby daughters. They were 5 or 6. They weren't babies, but they'd never been able to see him vote because he'd lost the ability at 18. So it's going to be pretty special. We set up a website that people can go on to confirm that their rights have been restored. We worked with the clerks to make that system as easy as possible. We've done a number of videos and to get the word out there, and there are numerous various groups that are out there right now working to inform and to get people to actually register and vote. It's exciting. We're people of second chances, and being a part of democracy, there's something that's going to be really special if whether it's 190,000 or 100,000 get to walk in and cast their vote for the first time or for the first time in a long time.
Do you have a travel advisory? I'm asking that because obviously it's Labor Day weekend, so you can imagine there's a lot of people who will be out traveling. So also.
Yeah. James, you have the last travel advisory. We update it about once a week. We do have this week's. Again, there's a lot going on out there, and rates shoot up and shoot down. These are all areas that are really concerning. But on this Labor Day weekend, again, I'd highly encourage you. Small groups at somebody's house, really think it out about how you'll spread out as much outside as possible. And I would travel as little as possible. Going to the beach, still very dangerous, even in the states that aren't here. And if you're going to your parents or to your grandparents, just remember if they fall into one of the categories where we need to worry a little bit more, be even more careful. I'm really careful with my parents. They are incredibly special people to me and to their grandkids, and it's one of the things that drives me each day when it's hard to do this. It's hard to make some of the decisions, but the individuals we lose are just as special to their family as my parents are to me, or they are to their grandkids. All right, so we won't be back again live until Tuesday. I was corrected on that yesterday. But we will either through video or through press release have updates on the numbers throughout the weekend. But please be safe. Remember that if we let our guards down just because we want to have a certain Labor Day celebration, it can harm business. It can harm the opportunity our kids have. It can get in the way of sports. So let's prioritize. Let's make sure we continue to be the good Kentuckians we are. And we're going to get through this, and we're going to get through it together. Thank you, Rachel.